Hello, nursing students. Welcome to our channel, Nursing Exam Preparation. In this video, we'll guide you through the top 250 pediatric nursing true or false questions and answers, each accompanied by detailed explanations to ensure you fully grasp the concepts. This comprehensive resource is tailored to support your nursing exam preparation, equipping you with the tools to excel in pediatric nursing and confidently tackle related questions. Feel free to watch the video as many times as you need. Repetition is key to mastering the material and building your understanding. Whether you're just starting your studies or polishing up for a final review, these questions are designed to test your knowledge, challenge your critical thinking, and reinforce essential pediatric nursing principles. Don't forget to like this video, share it with your fellow students, and subscribe to Nursing Exam Preparation for more valuable content to support your success. Hit the bell icon to stay updated with all our latest videos packed with tips, strategies, and exam-focused resources. Once you've completed the video, be sure to comment below with your score. We'd love to know how you did. Let's dive into the world of pediatric nursing, sharpen your skills, and get ready to ace your exams with confidence. Pediatric nursing true-false answer. True. Rationale. Acetaminophen is commonly used for pain management in infants, including those as young as 6 months, under appropriate dosages and physician guidance. It is safe and effective for managing mild to moderate pain in infants when dosed correctly. 2. It is important for a nurse to avoid administering live vaccines to a child who is immunocompromised due to cancer treatment. True or false? Answer. True. Rationale. Children who are immunocompromised, such as those undergoing cancer treatment, should not receive live vaccines due to the risk of the weakened virus causing disease. Inactivated vaccines are safer alternatives in these cases. 3. A nurse should initiate contact precautions for a child diagnosed with rotavirus infection. True or false? Answer. False. Rationale. Rotavirus is primarily transmitted via the fecal-oral route, and while it requires standard precautions, e.g., hand hygiene, it typically does not require contact precautions unless the child has diarrhea or vomiting, which increases transmission risk. 4. The nurse should administer ibuprofen to reduce fever in a child younger than 6 months old. True or false? Answer. False. Rationale. Ibuprofen is generally not recommended for children younger than 6 months old due to the risk of renal toxicity. Acetaminophen is a safer option for fever management in infants of this age group. 5. Children with asthma should be taught how to use a metered-dose inhaler, MDI, with a spacer to ensure proper medication delivery. True or false? Answer. True. Rationale. The use of a metered-dose inhaler with a spacer is recommended for children with asthma to ensure proper medication delivery and improve the effectiveness of the inhaled medication. Spacers help avoid improper technique and increase the amount of medication reaching the lungs. 6. A child diagnosed with acute lymphoblastic leukemia, ALL, should receive a live vaccine during chemotherapy treatment. True or false? Answer. False. Rationale. Live vaccines should be avoided in immunocompromised children, including those receiving chemotherapy, due to the risk of infection from the weakened virus. Inactivated vaccines are preferred. 7. Children aged 2 years are expected to be able to walk and run with coordination. True or false? Answer. True. Rationale. At 2 years of age, children generally have the motor skills necessary to walk and run with some coordination. This is part of the typical development of gross motor skills at this stage. 8. When administering digoxin to a child, the nurse should check the child's heart rate before giving the medication. True or false? Answer. True. Rationale. The nurse should assess the child's heart rate before administering digoxin, as a heart rate below the normal threshold, generally less than 90 to 110 bpm in infants and young children, can increase the risk of toxicity. 9. A fever above 102 degrees Fahrenheit 38.9 degrees Celsius in a 3-month-old infant should be treated immediately with antipyretics. True or false? Answer. False. Rationale. A fever in an infant younger than 3 months, especially above 100.4 degrees Fahrenheit 38 degrees Celsius, is considered a medical emergency. The infant should be assessed immediately by a healthcare provider before administering antipyretics. 10. The nurse should use an oral syringe to administer liquid medications to an infant. True or false? Answer: true. Rationale: oral syringes are used to administer liquid medications to infants as they provide accurate dosing and help prevent aspiration. They're safer than household spoons. 11. A nurse should hold a scheduled dose of amoxicillin if a child has a documented penicillin allergy. True or false? Answer: true. Rationale: if a child has a documented penicillin allergy, amoxicillin, which is part of the penicillin class, should be avoided to prevent allergic reactions such as anaphylaxis. 12. The nurse should administer a tetanus booster to a child who has a deep puncture wound, even if their last vaccine was within 5 years. True or false? Answer: true. Rationale: tetanus boosters are typically given to children who have deep puncture wounds or other high-risk injuries, even if their last tetanus vaccine was within 5 years, depending on the nature of the injury. 13. Children who have undergone tonsillectomy should avoid acidic foods like citrus to prevent irritation. True or false? Answer: true. Rationale: acidic foods, such as citrus, can irritate the healing tissue in the throat after a tonsillectomy, leading to increased discomfort and possible complications. 14. An infant who is unable to breastfeed should be given formula in a bottle. True or false? Answer: false. Rationale: if an infant cannot breastfeed, it is recommended to use a spoon, syringe, or cup for formula feeding rather than a bottle, as it can cause confusion and hinder proper latch and breastfeeding efforts. 15. Children with eczema should be bathed in hot water to help soothe dry, itchy skin. True or false? Answer: false. Rationale: hot water can dry out and irritate the skin further in children with eczema. Lukewarm water is recommended for baths to prevent skin irritation. 16. A nurse should immediately administer oxygen to a child with asthma who is experiencing severe wheezing and respiratory distress. True or false? Answer: true. Rationale: in cases of severe asthma exacerbations with wheezing and respiratory distress, administering oxygen is crucial to ensure adequate oxygenation and avoid hypoxia. 17. A child who is experiencing a seizure should be placed in a supine position to prevent aspiration. True or false? Answer: false. Rationale: the child should be placed in a side-lying position during a seizure to prevent aspiration and facilitate the clearing of any secretions or vomit. 18. It is safe for a nurse to administer a live attenuated influenza vaccine (LAIV) to a child with a history of asthma. True or false? Answer: false. Rationale: children with asthma, especially those with a history of severe asthma, should avoid receiving the live attenuated influenza vaccine (LAIV) due to the risk of exacerbating respiratory symptoms. 19. Children who are being treated for tuberculosis should complete their full course of prescribed medications to prevent the development of drug-resistant TB. True or false? Answer: true. Rationale: completing the entire prescribed course of tuberculosis medication is essential to ensure eradication of the infection and prevent the development of drug-resistant strains of Mycobacterium tuberculosis. 20. It is safe to administer ibuprofen to a child who is dehydrated. True or false? Answer: false. Rationale: ibuprofen should not be given to dehydrated children because it can exacerbate kidney problems. Dehydration increases the risk of kidney damage when using nonsteroidal anti-inflammatory drugs, NSAIDs, like ibuprofen. 21. The nurse should assess a child's respiratory rate before administering morphine for pain relief. True or false? Answer: true. Rationale: respiratory depression is a potential side effect of morphine. Therefore, the nurse should assess the child's respiratory rate before administering this medication to ensure it is within safe limits. 22. A 5-year-old child should be able to sit still for a few minutes during an injection. True or false? Answer: false. Rationale: a 5-year-old child may have difficulty sitting still for long periods. The nurse should provide distraction techniques and use appropriate techniques to minimize discomfort during injections. 23. The nurse should avoid administering benzodiazepines to children under 12 years old unless absolutely necessary due to the risk of adverse effects. True or false? Answer: true. Rationale: benzodiazepines should be used cautiously in children under 12 due to potential side effects such as sedation, respiratory depression, and behavioral changes. Alternative medications are often preferred. 24. When giving a child an intramuscular injection, the nurse should use the deltoid muscle for infants under 6 months old. True or false? Answer: false. Rationale: for infants under 6 months old, the nurse should use the vastus lateralis muscle for intramuscular injections, as the deltoid muscle is underdeveloped in this age group. 25. It is important for the nurse to monitor a child's blood pressure regularly while on corticosteroid therapy for asthma. True or false? Answer: true. Rationale: corticosteroids can increase blood pressure as a side effect. Regular monitoring is essential, especially in children with long-term use, to detect hypertension early. 26. The nurse should administer acetaminophen with caution to a child with liver disease. True or false? Answer: true. Rationale: acetaminophen is metabolized by the liver, and children with liver disease are at higher risk of liver damage from acetaminophen toxicity. The dosage should be carefully monitored. 27. A nurse should notify a pediatrician if a child receiving chemotherapy for cancer has a fever above 101 degrees Fahrenheit 38.3 degrees Celsius. True or false? Answer: true. Rationale: a fever in a child receiving chemotherapy can be indicative of infection, and children with weakened immune systems require immediate medical evaluation to prevent complications. 28. A nurse should administer medications to a child based on the child's weight rather than age when possible. True or false? Answer: true. Rationale: pediatric medication doses are often calculated based on the child's weight to ensure accuracy, as weight is a better indicator of the child's drug metabolism and response. 29. The nurse should delay immunization in a child with a mild cold. True or false? Answer: false. Rationale: mild illness or a cold is not a contraindication for immunizations. Vaccines should generally be administered according to the schedule, unless the child has a more serious illness. 30. The nurse should always check the child's current weight before administering an antibiotic based on body weight. True or false? Answer: true. Rationale: antibiotic doses are often weight-based. The nurse should always check the child's current weight to calculate the correct dosage, as improper dosing can lead to ineffective treatment or toxicity. 31. The nurse should not administer any live vaccines to a child who is currently on immunosuppressive therapy. True or false? Answer: true. Rationale: immunosuppressive therapy can impair the child's immune response, increasing the risk of infection from live vaccines. Therefore, these vaccines should be avoided. 32. Children receiving chemotherapy should be taught to take their temperature regularly to monitor for signs of infection. True or false? Answer: true. Rationale: chemotherapy weakens the immune system, making children more susceptible to infections. Regular temperature monitoring is crucial for detecting fever early, which is often the first sign of an infection. 33. It is safe for a nurse to administer a vaccine to a child who has been taking antibiotics for an ear infection. True or false? Answer: true. Rationale: antibiotics for an ear infection do not interfere with the immune system's ability to respond to vaccines. Vaccinations should be administered according to the schedule, unless there are other contraindications. 34. The nurse should administer oral rehydration solutions to a child with diarrhea and vomiting caused by a viral infection. True or false? Answer: true. Rationale: oral rehydration solutions are essential for preventing dehydration in children with diarrhea and vomiting, helping to replace lost fluids and electrolytes. 35. A nurse should assess for signs of dehydration in a child with prolonged diarrhea or vomiting, even if the child is alert. True or false? Answer: true. Rationale: dehydration can occur even in alert children. Signs like dry mucous membranes, reduced urine output, and lethargy should be monitored closely to prevent severe dehydration. 36. A nurse should allow a 6-month-old infant to self-feed with a bottle to encourage independence. True or false? Answer: false. Rationale: infants at 6 months old are not developmentally ready to self-feed with a bottle. Caregivers should support feeding and ensure safety, preventing potential choking or aspiration. 37. A nurse should educate parents to administer honey to a child under 1 year old for cough relief. True or false? Answer: false. Rationale: honey should not be given to children under 1 year old due to the risk of botulism, which can cause serious illness in infants. 38. Children with cystic fibrosis need pancreatic enzyme replacements to aid digestion. True or false? Answer: true. Rationale: children with cystic fibrosis lack adequate pancreatic enzymes, leading to difficulty digesting food. Pancreatic enzyme replacement is necessary for proper digestion and nutrient absorption. 39. The nurse should encourage the use of large, hard foods for teething infants to help relieve pain. True or false? Answer: false. Rationale: hard foods, like large crackers or raw carrots, can pose a choking hazard. Softer, safe teething toys or chilled teething rings should be encouraged instead. 40. A nurse should administer the DTaP vaccine to a 12-month-old child. True or false? Answer: true. Rationale: the DTaP vaccine is part of the routine immunization schedule and is given to children at 2, 4, 6, and 15 to 18 months, with the first dose at 2 months. 41. A child diagnosed with gastroenteritis should be given apple juice as the primary rehydration solution. True or false? Answer: false. Rationale: apple juice can worsen diarrhea. Oral rehydration solutions, ORS, containing electrolytes are preferred to prevent dehydration and restore electrolyte balance. 42. The nurse should avoid administering any over-the-counter cold medications to a child under 4 years old. True or false? Answer: true. Rationale: over-the-counter cold medications are not recommended for children under 4 due to the risk of severe side effects, including overdose and respiratory issues. 43. A child with asthma should avoid physical activity to prevent asthma attacks. True or false? Answer: false. Rationale: physical activity is important for children with asthma. With proper management and medication, most children can engage in physical activities safely. 44. In infants, colic is typically caused by a food allergy or infection. True or false? Answer: false. Rationale: colic is generally caused by immature digestion systems and is not usually linked to food allergies or infections. It typically resolves on its own by 3 to 4 months of age. 45. A child with sickle cell anemia is at risk for dehydration and should be encouraged to drink fluids regularly. True or false? Answer: true. Rationale: dehydration can exacerbate sickle cell crises by causing blood cells to sickle more easily. Adequate hydration is essential for managing the condition. 46. The nurse should use an adult-sized BP cuff for children aged 8 years and older when measuring blood pressure. True or false? Answer: false. Rationale: a pediatric-sized BP cuff should be used to accurately measure blood pressure in children. An adult-sized cuff can result in inaccurate readings. 47. Children with chickenpox should be excluded from school until all lesions are crusted over. True or false? Answer: true. Rationale: children with chickenpox should be kept home from school until all lesions have crusted over to prevent transmission of the varicella virus. 48. It is appropriate to give acetaminophen to a child under 6 months of age for fever reduction. True or false? Answer: true. Rationale: acetaminophen is safe for use in children under 6 months, but the dosage should be carefully calculated based on the child's weight. 49. Children diagnosed with type 1 diabetes should avoid all sources of carbohydrates. True or false? Answer: false. Rationale: children with type 1 diabetes need a balanced diet that includes carbohydrates. The key is to monitor carbohydrate intake and adjust insulin accordingly to maintain stable blood glucose levels. 50. The nurse should instruct parents to apply sunscreen to a child under 6 months of age only if they will be exposed to the sun for extended periods. True or false? Answer: false. Rationale: sunscreen should be applied to infants over 6 months of age for any sun exposure. For infants under 6 months, physical sun protection, e.g., hats, clothing, is preferred. 51. A child experiencing acute pain should be given a larger dose of opioid medications than the prescribed dose to ensure pain relief. True or false? Answer: false. Rationale: opioid doses should not exceed prescribed amounts. Safe and effective pain management involves following prescribed dosing, monitoring for side effects, and reassessing pain levels regularly. 52. A nurse should assess a child's immunization history before administering any vaccines. True or false? Answer: true. Rationale: it is essential to check the child's immunization history to ensure they are up to date on vaccinations and to avoid administering duplicate doses. 53. Children with a history of febrile seizures should avoid taking antipyretics to reduce fever. True or false? Answer: false. Rationale: antipyretics, such as acetaminophen or ibuprofen, can be used to manage fever in children with a history of febrile seizures. The goal is to prevent fever from rising too quickly, though medications should be given based on the physician's instructions. 54. A 2-year-old child should be able to walk up and down stairs while holding onto a rail. True or false? Answer: true. Rationale: by 2 years of age, children typically begin to develop the coordination necessary to walk up and down stairs with support, such as holding a rail or an adult's hand. 55. A nurse should check a child's blood glucose level before administering insulin, even if the child is not showing symptoms of hypoglycemia. True or false? Answer: true. Rationale: blood glucose levels should be checked before administering insulin to ensure the correct dosage is given and to prevent hypoglycemia, even if symptoms are not present. 56. A child diagnosed with a congenital heart defect should avoid vaccinations that contain live viruses. True or false? Answer: false. Rationale: most children with congenital heart defects can receive vaccinations, including those with live viruses, unless contraindicated. Immunization schedules should be followed after evaluating the child's specific health condition. 57. A nurse should avoid using distraction techniques like blowing bubbles during painful procedures for toddlers. True or false? Answer: false. Rationale: distraction techniques like blowing bubbles are effective for reducing anxiety and pain in toddlers during procedures, making them feel more relaxed and less focused on the pain. 58. When administering oral medications to a child, the nurse should check for a medication label and confirm the dosage is appropriate based on the child's weight. True or false? Answer: true. Rationale: medication dosages for children are typically weight-based, and it is crucial to confirm the correct dosage before administration to ensure safety and effectiveness. 59. The nurse should apply ice packs directly to a burn to cool the affected area immediately. True or false? Answer: false. Rationale: ice should not be applied directly to burns, as it can cause further tissue damage. Cool, not cold, running water should be used to soothe the burn. 60. A child who has had a recent tonsillectomy should be encouraged to consume hard, crunchy foods to aid healing. True or false? Answer: false. Rationale: after tonsillectomy, soft foods and liquids should be encouraged to avoid irritating the surgical site. Hard, crunchy foods can cause pain and increase the risk of bleeding. 61. A nurse should always check for the child's allergies before administering a new medication. True or false? Answer: true. Rationale: checking for allergies before administering medication is essential to prevent adverse reactions, including severe allergic responses like anaphylaxis. 62. A nurse should administer acetaminophen to a 3-month-old infant every 4 hours for fever. True or false? Answer: false. Rationale: acetaminophen should not be administered more than every 6 hours in infants under 6 months old. Dosage and frequency should be based on weight and age. 63. The nurse should monitor a child for respiratory depression after administering morphine for postoperative pain. True or false? Answer: true. Rationale: morphine is an opioid and respiratory depression is a common side effect, especially in pediatric patients. Close monitoring of vital signs is crucial to prevent complications. 64. A 5-year-old child is expected to have the ability to dress themselves independently. True or false? Answer: true. Rationale: by age 5, children typically develop the fine motor skills and coordination necessary to dress themselves independently, although they may still need some help with buttons or zippers. 65. A child diagnosed with type 1 diabetes requires insulin therapy for blood glucose control. True or false? Answer: true. Rationale: type 1 diabetes is characterized by the inability to produce insulin, so insulin therapy is necessary for blood glucose regulation and prevention of complications. 66. A nurse should encourage breastfeeding for the first 6 months of life, even for infants with medical conditions. True or false? Answer: true. Rationale: breastfeeding provides essential nutrients and immune protection for all infants, even those with medical conditions, unless contraindicated by specific health issues. 67. A child with a fever of 39.5 degrees Celsius (103.1 degrees Fahrenheit) should be given ibuprofen as the first line of treatment. True or false? Answer: true. Rationale: ibuprofen is commonly used to reduce fever and discomfort in children, as long as it is dosed appropriately for their age and weight. 68. A nurse should apply sunscreen to a child under 6 months of age only if they will be exposed to the sun for extended periods. True or false? Answer: false. Rationale: sunscreen should be used for infants older than 6 months. For infants younger than 6 months, sun exposure should be minimized and physical barriers, like clothing and hats, should be used for protection. 69. It is safe for a child with a peanut allergy to consume food labeled may contain traces of peanuts. True or false? Answer: false. Rationale: children with a peanut allergy should avoid foods labeled with may contain traces of peanuts due to the risk of severe allergic reactions. 70. The nurse should encourage regular hand washing in children as a primary prevention strategy for respiratory infections. True or false? Answer: true. Rationale: hand washing is one of the most effective ways to prevent the spread of infections, including respiratory illnesses, in children. 71. A child with a suspected head injury should be observed for 30 minutes before being evaluated by a healthcare provider. True or false? Answer: false. Rationale: any child with a suspected head injury should be evaluated immediately by a healthcare provider to assess for signs of serious conditions such as a concussion or internal bleeding. 72. A child who has had a full meal can safely receive an intramuscular (IM) injection without additional concern. True or false? Answer: true. Rationale: there are no specific dietary restrictions for a child receiving an IM injection, but the nurse should ensure the child is comfortable and hydrated before the procedure. 73. When administering pediatric medications, the nurse should always use the child's weight, not age, to determine the appropriate dose. True or false? Answer: true. Rationale: pediatric doses are based on weight to ensure accurate dosing and avoid overdose or underdose, especially for critical medications. 74. A 2-year-old child is able to understand the concept of delayed gratification. True or false? Answer: false. Rationale: at 2 years old, children are typically focused on immediate gratification and may not fully understand the concept of waiting or delayed rewards. 75. It is safe to administer live vaccines to children who are mildly ill as long as they do not have a fever. True or false? Answer: false. Rationale: live vaccines should not be administered to children who are mildly ill, especially if they have even a mild fever, to avoid the risk of adverse reactions. 76. For a child with severe asthma, a bronchodilator should be administered first before any corticosteroid inhalers. True or false? Answer: true. Rationale: in acute asthma attacks, bronchodilators, e.g., albuterol, should be administered first to open the airways before corticosteroids to reduce inflammation and prevent further airway constriction. 77. The nurse should notify the healthcare provider if a child with a chronic illness presents with fever over 38 degrees Celsius, 100.4 degrees Fahrenheit. True or false? Answer: true. Rationale: children with chronic illnesses may have compromised immune systems or be more vulnerable to complications from fever, requiring close monitoring and potential intervention by a healthcare provider. 78. A child with a mild case of chickenpox can safely attend school after the first lesion appears. True or false? Answer: false. Rationale: children with chickenpox should be kept home from school until all lesions have crusted over to prevent the spread of the virus. 79. An infant's weight should double by the time they reach 5 months of age. True or false? Answer: true. Rationale: by 5 months, most infants will have doubled their birth weight, which is a key developmental milestone. 80. A nurse should use a sterile saline solution to clean a wound on a 5-year-old child. True or false? Answer: true. Rationale: sterile saline is ideal for cleaning wounds as it is gentle and reduces the risk of infection while promoting healing. 81. A child should be encouraged to drink plenty of fluids when receiving antibiotics to prevent dehydration. True or false? Answer: true. Rationale: antibiotics can cause dehydration through side effects like diarrhea. Encouraging fluid intake helps prevent dehydration and supports overall health. 82. A nurse should apply a cold compress to a child's arm after an intramuscular injection to reduce pain. True or false? Answer: false. Rationale: applying heat, not cold, to the area after an intramuscular injection helps improve circulation and reduce muscle stiffness. Cold compresses may numb the area, but are not as effective for this purpose. 83. It is acceptable to give honey to infants under 1 year old to soothe a cough. True or false? Answer: false. Rationale: honey should not be given to infants under 1 year old due to the risk of botulism, which can cause serious health complications in young children. 84. A 4-year-old child is capable of comprehending the concepts of time and sequencing. True or false? Answer: true. Rationale: by age 4, children begin to understand the concept of time in simple terms, e.g., later or soon, although they may still struggle with more complex time concepts. 85. A nurse should monitor a child for signs of hypoglycemia after administering insulin for type 1 diabetes. True or false? Answer: true. Rationale: insulin administration can cause hypoglycemia, particularly if too much insulin is given, so it is crucial to monitor blood sugar levels and look for symptoms like shakiness, sweating, or confusion. 86. A nurse can safely administer aspirin to a child with a fever. True or false? Answer: false. Rationale: aspirin should not be given to children due to the risk of Reye's syndrome, a rare but serious condition that can cause liver and brain damage. 87. It is safe for children with asthma to use bronchodilators as needed for shortness of breath. True or false? Answer: true. Rationale: short-acting bronchodilators, e.g., albuterol, are commonly used to relieve acute asthma symptoms such as shortness of breath, but they should be used according to the child's individualized asthma management plan. 88. The nurse should place a child with a respiratory infection in a supine position to aid in breathing. True or false? Answer: false. Rationale: children with respiratory infections should be positioned in a semi-Fowler's position, elevated head, to help ease breathing and reduce the risk of aspiration. 89. It is important for the nurse to verify the medication dosage based on a child's weight before administering any medication. True or false? Answer: true. Rationale: pediatric medication dosages are typically calculated based on the child's weight to ensure accuracy and minimize the risk of overdose or underdose. 90. A 10-year-old child is typically able to understand the full impact of a chronic illness like asthma. True or false? Answer: true. Rationale: by age 10, children can grasp the concept of chronic illnesses, understand their treatment plans, and actively participate in managing their condition. 91. The nurse should use the smallest gauge needle available when administering an intramuscular injection to a pediatric patient. True or false? Answer: true. Rationale: using a smaller gauge needle, e.g., 23 to 25 gauge, for intramuscular injections in pediatric patients helps minimize discomfort and trauma during the procedure. 92. A nurse should always monitor a child who is receiving fluids for signs of fluid overload. True or false? Answer: true. Rationale: pediatric patients are at higher risk for fluid overload, so careful monitoring of input, output, and vital signs is essential to prevent complications such as edema or respiratory distress. 93. Children under the age of 2 should not be given solid food, as their digestive systems are not ready for it. True or false? Answer: false. Rationale: infants can begin eating solid foods, such as pureed vegetables or cereals, around 6 months of age as their digestive systems mature, though the introduction of solids should be gradual. 94. The nurse should educate parents to limit screen time for children younger than 2 years old to promote healthy development. True or false? Answer: true. Rationale: according to the American Academy of Pediatrics, children under 2 years old should have limited screen time to encourage developmental activities like play, reading, and physical interaction. 95. It is important for a nurse to verify a child's immunization history before administering any vaccine. True or false? Answer: true. Rationale: verifying a child's immunization history ensures that the right vaccine is administered and avoids overvaccination or delays in the vaccination schedule. 96. Children with celiac disease should avoid gluten-containing foods for life. True or false? Answer: true. Rationale: children with celiac disease have an autoimmune reaction to gluten, which can cause damage to the small intestine. Lifelong adherence to a gluten-free diet is necessary to prevent symptoms and complications. 97. A nurse should avoid using over-the-counter cold medicines in children under the age of 4. True or false? Answer: true. Rationale: over-the-counter cold medicines are not recommended for children under 4 years old due to the risk of side effects and overdose. 98. The nurse should never administer a liquid medication without double-checking the dosage for pediatric patients. True or false? Answer: true. Rationale: medication dosages for children must be verified to ensure safety and accuracy. Incorrect dosages can lead to serious side effects or toxicity. 99. A nurse should withhold oral medications if a child is vomiting unless directed otherwise by a healthcare provider. True or false? Answer: true. Rationale: vomiting can affect the absorption of oral medications. If vomiting persists, a nurse should consult a healthcare provider to determine whether the medication should be withheld or administered in another form. 100. The nurse should be cautious when administering medications to a child who is underweight, as they may metabolize drugs differently. True or false? Answer: true. Rationale: underweight children may have altered drug metabolism, which can affect how medications are absorbed and processed. Adjustments in dosing may be necessary. 101. A child with a fever should always be given acetaminophen to lower the temperature. True or false? Answer: false. Rationale: while acetaminophen can help lower fever, it is not always the first line of treatment, especially if the fever is low-grade or the child is otherwise stable. Fever can be a sign of infection and does not always require medication unless it is causing discomfort or reaching dangerous levels. 102. A nurse should administer vaccines at a fixed schedule, even if the child is mildly ill with a cold. True or false? Answer: true. Rationale: vaccines can generally be administered during mild illness, such as a cold, as long as the child does not have a fever or more severe illness. However, the nurse should assess the child's condition before proceeding. 103. When managing a child with asthma, it is important to assess their peak flow readings to determine the severity of the asthma attack. True or false? Answer: true. Rationale: peak flow readings help assess how well air is moving in and out of the lungs and can be used to monitor asthma control and the severity of an attack, helping to guide treatment decisions. 104. A nurse should administer ibuprofen to children under 6 months of age for fever reduction. True or false? Answer: false. Rationale: ibuprofen is not recommended for infants under 6 months of age. Acetaminophen is typically the preferred choice for fever management in infants. 105. A child's weight should be monitored regularly to assess the effectiveness of medications in pediatric care. True or false? Answer: true. Rationale: pediatric medication dosages are often calculated based on weight, so regular monitoring ensures that doses are appropriately adjusted and safe for the child. 106. The nurse should avoid giving honey to infants under 1 year old due to the risk of botulism. True or false? Answer: true. Rationale: honey can contain spores of Clostridium botulinum, which can cause botulism in infants under 1 year old, leading to severe illness. 107. It is safe to give children aged 3 to 5 years unlimited screen time to promote their cognitive development. True or false? Answer: false. Rationale: the American Academy of Pediatrics recommends limiting screen time for children aged 3 to 5 years to no more than 1 hour per day to promote healthy cognitive and social development. 108. Children with type 1 diabetes require regular insulin administration based on their blood glucose levels. True or false? Answer: true. Rationale: type 1 diabetes requires lifelong insulin therapy to regulate blood glucose levels, often through multiple daily injections or an insulin pump. 109. A nurse should encourage the use of large doses of vitamins in children to boost their immune system during the winter months. True or false? Answer: false. Rationale: excessive vitamin intake can be harmful, especially fat-soluble vitamins that accumulate in the body. Proper nutrition and a balanced diet are more effective for immune support. 110. Pain management strategies for children should be based on their developmental stage and ability to express pain. True or false? Answer: true. Rationale: pain management should be tailored to a child's developmental stage, considering their ability to understand and communicate pain, and age-appropriate interventions should be used. 111. Antibiotics should be given to children with viral infections to speed up recovery. True or false? Answer: false. Rationale: antibiotics are only effective against bacterial infections, not viral infections. Using antibiotics unnecessarily can lead to antibiotic resistance. 112. A nurse should always assess a child's pain level using a pain scale appropriate for their age. True or false? Answer: true. Rationale: pain assessment in children should use age-appropriate tools, such as the FACES pain scale or numeric rating scale, to ensure an accurate understanding of the child's pain level. 113. A nurse can delegate the administration of oral medications to a child's family members as long as they are trained. True or false? Answer: true. Rationale: if family members are trained and competent, the administration of oral medications can be delegated. However, the nurse should still monitor the child for side effects and ensure compliance. 114. A child with a fever and a rash should be assessed for possible infectious diseases, such as measles or chickenpox. True or false? Answer: true. Rationale: fever and rash are common signs of infectious diseases like measles or chickenpox. Early assessment and diagnosis are essential for appropriate treatment and isolation to prevent transmission. 115. It is important to educate parents of children with ADHD about the importance of structured routines and clear expectations. True or false? Answer: true. Rationale: children with ADHD benefit from structured routines as they help manage symptoms by providing predictability, which can improve focus and reduce behavior issues. 116. A nurse should always notify a healthcare provider if a child's vital signs significantly worsen after receiving a vaccine. True or false? Answer: true. Rationale: although most children tolerate vaccines well, adverse reactions such as changes in vital signs, fever, tachycardia, should be promptly reported to ensure appropriate follow-up care. 117. A nurse should teach parents that antibiotics can be stopped once their child starts feeling better, even if the prescribed course is not completed. True or false? Answer: false. Rationale: It is crucial to complete the full course of antibiotics to ensure that the infection is fully treated and to prevent the development of antibiotic resistance. 118. The nurse should monitor a child with a history of seizures closely when administering any new medications, as some drugs can lower the seizure threshold. True or false? Answer: true. Rationale: some medications, particularly certain antidepressants and antipsychotics, can lower the seizure threshold, so children with a history of seizures require close monitoring when starting new medications. 119. A nurse should always administer pediatric medications using adult-sized syringes to ensure accuracy. True or false? Answer: false. Rationale: pediatric medications should always be administered using syringes and tools that are sized appropriately for the child's age to ensure accurate dosing. 120. When administering a blood transfusion to a child, the nurse should monitor the child closely for signs of transfusion reactions during the first 15 minutes. True or false? Answer: true. Rationale: the first 15 minutes after starting a transfusion is the most critical time for monitoring for signs of a transfusion reaction, such as fever, rash, or difficulty breathing. 121. It is safe to give over-the-counter cough and cold medications to children under 2 years of age. True or false? Answer: false. Rationale: the American Academy of Pediatrics advises against using over-the-counter cough and cold medications in children under 2 years old due to the risk of serious side effects, including respiratory distress and seizures. 122. A nurse should always wash their hands before administering oral medications to children. True or false? Answer: true. Rationale: hand hygiene is crucial in preventing the spread of infections and ensuring medication administration is done safely and hygienically. 123. The nurse should inform parents that toddlers are typically ready for toilet training between 18 and 24 months of age. True or false? Answer: true. Rationale: many children are developmentally ready for toilet training between 18 and 24 months, although readiness varies for each child based on physical and emotional development. 124. In pediatric patients, a fever is generally defined as a temperature of 100 degrees Fahrenheit or higher. True or false? Answer: false. Rationale: a fever in children is typically defined as a temperature of 100.4 degrees Fahrenheit 38 degrees Celsius or higher. A temperature of 100 degrees Fahrenheit is considered a mild elevation, but it does not meet the criteria for a fever. 125. It is recommended to administer morphine to children with moderate to severe pain following surgery. True or false? Answer: true. Rationale: morphine is often used in pediatric patients to manage moderate to severe post-surgical pain, but it should be dosed carefully, with close monitoring due to the risk of respiratory depression and other side effects. 126. Breastfeeding is not recommended for infants with galactosemia due to their inability to metabolize lactose. True or false? Answer: true. Rationale: infants with galactosemia are unable to metabolize galactose, a sugar found in breast milk, so breastfeeding is contraindicated. Alternative feeding options are required. 127. It is important for parents to be educated about the use of epinephrine for children at risk for anaphylaxis. True or false? Answer: true. Rationale: parents of children at risk for anaphylaxis should be educated on how to use epinephrine autoinjectors to treat severe allergic reactions promptly. 128. A nurse should encourage a child with a sore throat to drink warm fluids to help soothe the throat. True or false? Answer: true. Rationale: warm fluids such as soup or tea can help soothe a sore throat and keep the child hydrated, which is important for recovery. 129. A nurse should avoid administering vaccines to children who have a mild fever. True or false? Answer: false. Rationale: mild illness, including a low-grade fever, is generally not a contraindication to vaccination. However, children with more severe illness or a high fever may need to postpone vaccination. 130. A nurse should immediately report any signs of a rash or swelling following a vaccine administration to a healthcare provider. True or false? Answer: true. Rationale: Signs of a rash or swelling could indicate an allergic reaction to the vaccine, and immediate reporting is necessary for proper management and safety. 131. Pediatric patients with a history of asthma should always use a bronchodilator before engaging in physical activity.
True or false?
Answer: true. Rationale: children with asthma often use a short-acting bronchodilator, e.g., albuterol, before physical activity to prevent exercise-induced bronchospasm. 132. The nurse should encourage parents to administer cough syrup to children older than 1 year to treat persistent coughs. True or false? Answer: false. Rationale: over-the-counter cough syrup is not recommended for young children due to the risk of side effects, and alternative measures such as honey or steam inhalation may be safer for children older than 1 year. 133. Children with Down syndrome typically experience slower development in motor and cognitive skills. True or false? Answer: true. Rationale: children with Down syndrome often experience delays in motor and cognitive development, although the extent can vary widely. Early intervention is important to support development. 134. A nurse should administer antibiotics as prescribed to treat a child's bacterial infection, even if the child starts feeling better before the full course is completed. True or false? Answer: true. Rationale: it is essential to complete the full course of antibiotics to ensure the infection is fully eradicated and to prevent antibiotic resistance. 135. It is safe to give children aspirin to reduce inflammation and fever during viral illnesses. True or false? Answer: false. Rationale: aspirin should not be given to children due to the risk of Reye's syndrome, a rare but serious condition that can affect the liver and brain. Acetaminophen or ibuprofen is preferred for fever and pain. 136. The nurse should assess a child for signs of dehydration when the child is vomiting or experiencing diarrhea. True or false? Answer: true. Rationale: vomiting and diarrhea can lead to fluid loss and dehydration, so it is crucial to monitor hydration status and replace fluids accordingly. 137. It is important to educate parents of children with ADHD about medication side effects, such as decreased appetite and sleep disturbances. True or false? Answer: true. Rationale: stimulant medications commonly used to treat ADHD can have side effects such as decreased appetite and insomnia. Parents should be informed and involved in monitoring for these effects. 138. A child with a mild allergic reaction can be treated with an oral antihistamine and should not require an epinephrine injection. True or false? Answer: true. Rationale: a mild allergic reaction may respond to an oral antihistamine, but an epinephrine injection is needed for more severe reactions, such as anaphylaxis. 139. A nurse should monitor a child receiving growth hormone therapy for signs of fluid retention, which can lead to hypertension. True or false? Answer: true. Rationale: growth hormone therapy can lead to fluid retention, which may result in elevated blood pressure. Monitoring for signs of fluid retention and hypertension is essential. 140. A child with a history of seizures should avoid taking over-the-counter cold medications that contain stimulants. True or false? Answer: true. Rationale: some cold medications contain stimulants, which can lower the seizure threshold and increase the risk of seizures, so they should be avoided in children with a history of seizures. 141. Parents of children with sickle cell anemia should be educated about the importance of maintaining adequate hydration. True or false? Answer: true. Rationale: adequate hydration is critical in children with sickle cell anemia as dehydration can trigger sickle cell crises, which are painful episodes due to blood flow obstruction. 142. The nurse should administer a second dose of a vaccine if the first dose was missed, even if the child has already received the second dose. True or false? Answer: false. Rationale: missing a dose does not require a repeat dose if the child has already received subsequent doses of a vaccine. The nurse should follow the appropriate immunization schedule and consult the immunization guidelines for catch-up vaccinations. 143. It is safe for children with asthma to participate in swimming as long as their asthma is well controlled. True or false? Answer: true. Rationale: Swimming can be a beneficial activity for children with asthma as it helps improve lung function and breathing. However, their asthma should be well controlled before engaging in physical activity. 144. A child with a fever should be bundled up in blankets to help raise their body temperature and break the fever. True or false? Answer: false. Rationale: bundling up a child with a fever can raise body temperature further, which can worsen the fever. It is better to keep the child in a cool, comfortable environment and offer fluids. 145. It is important to assess a child's pain using a pain scale appropriate for their developmental level. True or false? Answer: true. Rationale: different pain scales, such as the Wong-Baker-Faces scale for younger children, help accurately assess a child's pain level and provide appropriate pain management. 146. A nurse should administer intravenous fluids slowly in a child with dehydration to avoid overloading the heart.
True or false?
Answer: true. Rationale: in children with dehydration, fluids should be administered slowly to prevent overloading the heart and causing complications like fluid overload or heart failure. 147. It is safe for infants younger than 6 months to be given honey as a food supplement. True or false? Answer: false. Rationale: honey should not be given to infants younger than 12 months due to the risk of botulism, a rare but serious illness caused by Clostridium botulinum spores found in honey. 148. It is important to educate parents about recognizing the early signs of respiratory distress in infants, such as flaring nostrils and retractions. True or false? Answer: true. Rationale: early signs of respiratory distress, such as nostril flaring and retractions, indicate that the infant is struggling to breathe and needs immediate medical attention. 149. Children with autism may benefit from a structured routine to help manage anxiety and behavioral challenges. True or false? Answer: true. Rationale: a structured routine can provide predictability and reduce anxiety in children with autism spectrum disorder, ASD, helping to manage behavioral challenges. 150. Vaccines are not recommended for children with mild illnesses, such as a cold or low-grade fever. True or false? Answer: false. Rationale: mild illnesses, such as a cold or low-grade fever, are generally not contraindications for vaccination. Vaccination should proceed unless the child has a more severe illness. 151. A nurse should use a child-friendly technique, such as distraction or comfort holds, when administering injections to a child.
True or false?
Answer: true. Rationale: using child-friendly techniques like distraction or comfort holds can reduce a child's anxiety and pain during injections, improving the experience for both the child and caregiver. 152. A 2-year-old child is capable of understanding the concept of taking medications as prescribed. True or false? Answer: false. Rationale: at 2 years old, children generally do not have the cognitive ability to understand the concept of medication adherence. Parents should play a primary role in administering medications and ensuring compliance. 153. Oral rehydration solutions, ORS, are recommended for children with diarrhea to prevent dehydration.
True or false?
Answer: true. Rationale: oral rehydration solutions, ORS, are effective in replenishing fluids and electrolytes in children with diarrhea, helping to prevent dehydration and maintain fluid balance. 154. The nurse should encourage parents to allow their child with asthma to engage in physical activities like running, as long as the asthma is controlled. True or false? Answer: true. Rationale: children with controlled asthma should be encouraged to participate in physical activities, as it helps improve lung function and overall health. A pre-exercise bronchodilator can be used if needed. 155. Pain relief should always be the primary concern in pediatric patients with sickle cell disease during a pain crisis. True or false? Answer: true. Rationale: pain management is crucial in children with sickle cell disease during a pain crisis. The use of opioids and other pain relievers is essential to provide comfort and prevent suffering. 156. It is important to monitor a child receiving chemotherapy for signs of infection due to their weakened immune system. True or false? Answer: true. Rationale: Chemotherapy suppresses the immune system, making children more vulnerable to infections. Close monitoring and prompt treatment of any signs of infection are necessary. 157. It is safe for children with a history of febrile seizures to receive vaccinations without increased risk of seizure recurrence. True or false? Answer: true. Rationale: children with a history of febrile seizures can safely receive vaccinations. Vaccines are not associated with an increased risk of febrile seizures in most cases. 158. The nurse should administer acetaminophen to infants under 3 months old for fever management. True or false? Answer: false. Rationale: acetaminophen should not be given to infants under 3 months old unless specifically directed by a healthcare provider due to the potential for liver toxicity. 159. The nurse should administer antibiotics to children with viral infections like the common cold.
True or false?
Answer: false. Rationale: antibiotics are ineffective against viral infections like the common cold. They should only be used for bacterial infections to prevent the development of antibiotic resistance. 160. Infants should be placed on their backs to sleep to reduce the risk of sudden infant death syndrome, SIDS.
True or false?
Answer: true. Rationale: the Back to Sleep campaign has been shown to significantly reduce the risk of sudden infant death syndrome, SIDS, by decreasing the risk of suffocation and airway obstruction. 161. A nurse should avoid giving a child with a peanut allergy any food that may contain trace amounts of peanuts.
True or false?
Answer: true. Rationale: children with peanut allergies are at risk for severe allergic reactions, and even trace amounts of peanuts can trigger a reaction. Strict avoidance is necessary to prevent anaphylaxis. 162. It is safe to give over-the-counter fever reducers like ibuprofen to children with chickenpox. True or false? Answer: false. Rationale: it is not recommended to give ibuprofen to children with chickenpox, as it may increase the risk of complications like severe skin infections. Acetaminophen is a safer alternative. 163. A nurse should always check the growth chart to monitor a child's development in relation to their age. True or false? Answer: true. Rationale: the growth chart is an essential tool for tracking a child's physical development. Deviations from expected growth patterns can indicate underlying health issues. 164. Children with a history of asthma should avoid exposure to secondhand smoke, as it can exacerbate symptoms. True or false? Answer: true. Rationale: secondhand smoke can irritate the airways and worsen asthma symptoms in children, so it is essential to avoid exposure to secondhand smoke. 165. It is important for a nurse to monitor a child receiving corticosteroid therapy for potential side effects such as weight gain and mood changes.
True or false?
Answer: true. Rationale: corticosteroids can cause significant side effects such as weight gain, mood swings, and increased risk of infection. Regular monitoring is essential during corticosteroid therapy. 166. Parents should be educated on the importance of a healthy diet for a child diagnosed with type 1 diabetes.
True or false?
Answer: true. Rationale: a balanced diet is essential for managing type 1 diabetes, along with insulin therapy, to maintain stable blood glucose levels and prevent complications. 167. The nurse should encourage children with cystic fibrosis to participate in physical activities to improve lung function. True or false? Answer: true. Rationale: physical activity is beneficial for children with cystic fibrosis, as it helps improve lung function, enhance overall fitness, and clear mucus from the lungs. 168. A child with a congenital heart defect should avoid any strenuous physical activity. True or false? Answer: false. Rationale: not all congenital heart defects require the avoidance of physical activity. Activity recommendations depend on the severity and type of the heart defect. The healthcare provider should guide activity restrictions. 169. The nurse should educate parents about using a car seat appropriate for their child's weight and age to ensure safety during travel.
True or false?
Answer: true. Rationale: car seat safety is crucial for preventing injury in children. Parents should use an age and weight-appropriate car seat to ensure proper protection in the event of an accident. 170. It is safe to administer over-the-counter cough and cold medications to children under 2 years old.
True or false?
Answer: false. Rationale: over-the-counter cough and cold medications are not recommended for children under 2 years old due to the risk of serious side effects such as respiratory distress and overdose. 171. Infants and young children are more prone to dehydration than older children due to their higher body surface area.
True or false?
Answer: true. Rationale: infants and young children have a higher body surface area relative to their weight, making them more susceptible to dehydration, especially during illness or fever. 172. Children with a fever should be given aspirin to reduce the fever and discomfort.
True or false?
Answer: false. Rationale: aspirin should not be given to children due to the risk of Reye's syndrome, a rare but serious condition that can affect the liver and brain. Acetaminophen or ibuprofen is preferred. 173. The nurse should perform a thorough pain assessment before administering pain medication to a child post-surgery.
True or false?
Answer: true. Rationale: a thorough pain assessment is necessary to determine the appropriate dosage and type of pain medication to provide effective pain relief while minimizing side effects. 174. The nurse should educate parents to keep small objects, such as toys and buttons, out of reach of infants and toddlers to prevent choking hazards.
True or false?
Answer: true. Rationale: infants and toddlers are at risk of choking, so it is important for parents to keep small objects and toys that may present choking hazards out of their reach. 175. It is important for the nurse to educate parents of a child with juvenile diabetes about the signs of hypoglycemia and how to treat it.
True or false?
Answer: true. Rationale: children with juvenile diabetes are at risk for hypoglycemia, and parents should be educated on how to recognize the symptoms and treat low blood sugar promptly to prevent complications. 176. Children diagnosed with ADHD should be prescribed medications only if behavioral interventions are ineffective.
True or false?
Answer: true. Rationale: medications like stimulants are often prescribed for ADHD after behavioral interventions. Medications are usually considered when non-pharmacological treatments have not yielded sufficient results. 177. It is essential to monitor the growth and development of children with Down syndrome to detect any developmental delays.
True or false?
Answer: true. Rationale: children with Down syndrome often experience developmental delays. Regular monitoring helps to identify delays early, so appropriate interventions and therapies can be provided. 178. The nurse should never use an oral thermometer for temperature measurement in infants younger than 3 months old.
True or false?
Answer: true. Rationale: for infants younger than 3 months, an axillary or rectal thermometer is preferred to obtain an accurate temperature reading. Oral thermometers are not typically accurate in this age group. 179. The nurse should administer the MMR, measles, mumps, and rubella vaccine at 12 months of age and again at 4 to 6 years of age.
True or false?
Answer: true. Rationale: the MMR vaccine is given at 12 months and again at 4 to 6 years to ensure immunity against measles, mumps, and rubella. 180. The nurse should encourage parents to avoid using harsh discipline techniques, such as corporal punishment with children.
True or false?
Answer: true. Rationale: harsh discipline techniques like corporal punishment can lead to emotional and behavioral issues in children. Positive reinforcement and appropriate discipline strategies are more effective. 181. Children with eczema should avoid harsh soaps and use moisturizing lotions to prevent skin dryness and irritation.
True or false?
Answer: true. Rationale: children with eczema should avoid harsh soaps and use gentle, fragrance-free moisturizing lotions to maintain skin hydration and prevent flare-ups. 182. The nurse should educate parents to recognize the early signs of ear infections in children, including tugging at the ear and irritability.
True or false?
Answer: true. Rationale: tugging at the ear and irritability are common early signs of ear infections in children. Early recognition can help prevent complications and ensure timely treatment. 183. The nurse should educate parents of a child with a chronic illness to monitor for changes in behavior or mood, as these may be signs of an impending illness exacerbation. True or false? Answer: true. Rationale: changes in behavior or mood in children with chronic illnesses may signal an exacerbation or complication, and parents should be informed to report these changes to the healthcare provider. 184. The nurse should assess for signs of dehydration in infants, such as sunken fontanelles and dry mouth. True or false? Answer: true. Rationale: sunken fontanelles and a dry mouth are classic signs of dehydration in infants. Early identification and treatment are essential to prevent severe dehydration. 185. It is safe to administer honey to children under 6 months of age to soothe a cough. True or false? Answer: false. Rationale: honey should not be given to infants under 1 year of age due to the risk of botulism, which can cause life-threatening illness. 186. Children with asthma should be encouraged to avoid all physical activity to prevent asthma attacks. True or false? Answer: false. Rationale: children with asthma should be encouraged to engage in physical activities as long as their asthma is well controlled. Regular exercise can improve overall health and lung function. 187. The nurse should encourage breastfeeding for the first 6 months of life to promote optimal growth and immunity. True or false? Answer: true. Rationale: breastfeeding for the first 6 months provides optimal nutrition and immune protection for infants, as breast milk contains essential antibodies and nutrients. 188. It is important to monitor the urine output of children on diuretics, as they are at risk for electrolyte imbalances. True or false? Answer: true. Rationale: diuretics can cause electrolyte imbalances and dehydration, so monitoring urine output is essential to assess fluid balance and prevent complications. 189. It is not necessary for the nurse to provide education on safe sleep practices to parents of infants. True or false? Answer: false. Rationale: safe sleep practices, such as placing the infant on their back to sleep and avoiding soft bedding, should always be taught to parents to reduce the risk of sudden infant death syndrome, SIDS. 190. Children with a history of seizures should avoid hot baths to prevent seizure recurrence. True or false? Answer: true. Rationale: hot baths can trigger seizures in children with a history of seizures, as temperature changes may affect seizure thresholds. Lukewarm or cool baths are safer alternatives. 191. The nurse should administer vaccines to a child even if they have a mild fever. True or false? Answer: true. Rationale: vaccines can generally be administered to children with mild fever unless the fever is related to a severe illness or contraindication. A mild fever does not typically interfere with vaccine efficacy. 192. It is safe to give children older than 6 months a small amount of honey to relieve a sore throat. True or false? Answer: true. Rationale: honey can be given to children older than 1 year to soothe a sore throat. However, it should not be given to infants under 1 year due to the risk of botulism. 193. The nurse should use a high Fowler's position when administering oral medication to a child with difficulty swallowing. True or false? Answer: true. Rationale: a high Fowler's position helps facilitate swallowing and decreases the risk of aspiration when giving oral medication to children with swallowing difficulties. 194. The nurse should prioritize the administration of a medication based on the child's age and weight. True or false? Answer: true. Rationale: the dosage of medications in children is typically based on their age, weight, and sometimes body surface area to ensure safe and effective treatment. 195. A child who is severely dehydrated should be given plain water orally to restore fluid balance. True or false? Answer: false. Rationale: in cases of severe dehydration, oral rehydration solutions, ORS, containing electrolytes are recommended, as plain water does not replace lost electrolytes effectively. 196. A nurse should encourage parents of a child with asthma to monitor air quality and avoid outdoor activities during high pollution levels. True or false? Answer: true. Rationale: Poor air quality can trigger asthma attacks, so it is important for parents to monitor air quality and limit their child's exposure during poor weather or pollution levels. 197. The nurse should administer aspirin to children under 12 years old for pain relief. True or false? Answer: false. Rationale: aspirin is contraindicated for children under 12 years old due to the risk of Reye's syndrome, a potentially fatal condition that affects the liver and brain. 198. The nurse should never administer a vaccine if the child has an allergy to egg products, especially the flu vaccine.
True or false?
Answer: true. Rationale: some vaccines, such as the flu vaccine, contain egg proteins. Children with severe egg allergies should not receive these vaccines or should be administered an egg-free version when available. 199. For children with chronic conditions, the nurse should frequently assess developmental milestones to ensure normal progress.
True or false?
Answer: true. Rationale: monitoring developmental milestones is essential for children with chronic conditions to ensure they are meeting age-appropriate milestones and to identify potential delays early. 200. A nurse should instruct the parents of an infant with a fever to give acetaminophen to lower the temperature.
True or false?
Answer: true. Rationale: acetaminophen is generally recommended to reduce fever in infants over 3 months old. However, the nurse should guide the parents on the correct dosage based on the infant's weight and age. 201. Children with diabetes should be taught how to monitor their blood sugar levels and manage insulin injections.
True or false?
Answer: true. Rationale: children with diabetes should be taught to monitor their blood sugar levels regularly and understand how to manage insulin doses to maintain optimal glucose control. 202. The nurse should avoid using suppositories for medication administration in children under 2 years of age.
True or false?
Answer: false. Rationale: suppositories are often used in children under 2 years of age when oral administration is not feasible due to vomiting, difficulty swallowing, or other concerns. 203. A child with severe dehydration should receive oral rehydration therapy, ORT, first before considering intravenous for fluids. True or false? Answer: false. Rationale: severe dehydration, especially if there is altered mental status or shock, requires immediate fluid administration to rapidly restore fluid and electrolyte balance. Oral rehydration therapy is typically used for mild to moderate dehydration. 204. The nurse should avoid giving a child with a history of seizures the immunization for MMR, measles, mumps, rubella.
True or false?
Answer: false. Rationale: the MMR vaccine is generally safe for children with a history of seizures. It is recommended to consult with a healthcare provider, but the vaccine is not contraindicated in these children unless specified by other medical conditions. 205. A nurse should administer ibuprofen for pain management in a 3-month-old infant.
True or false?
Answer: false. Rationale: ibuprofen should not be administered to infants younger than 6 months without physician approval due to the risk of renal toxicity. 206. When administering pediatric medications, the nurse should always double-check the dosage with the prescribed weight-based calculation.
True or false?
Answer: true. Rationale: pediatric dosages must be accurately calculated based on weight or body surface area to avoid overdose or underdose. Always verify the dosage before administration. 207. A child with a history of seizures should not receive the MMR vaccine.
True or false?
Answer: false. Rationale: children with a history of seizures, unless contraindicated by other medical conditions, can safely receive the MMR vaccine. Seizures are not a contraindication for this vaccine. 208. It is safe to give over-the-counter cough and cold medications to a 6-year-old child.
True or false?
Answer: true. Rationale: most over-the-counter, OTC, cough, and cold medications are considered safe for children over 6, but the dosage should be carefully followed as per age guidelines. 209. Pediatric patients should be given medications in the form of liquid or chewable tablets whenever possible to prevent choking.
True or false?
Answer: true. Rationale: liquid or chewable medications are preferred for children as they are easier to swallow, reducing the risk of choking compared to whole tablets or capsules. 210. It is essential to monitor the weight and growth of a child receiving long-term corticosteroid therapy.
True or false?
Answer: true. Rationale: long-term corticosteroid therapy can lead to weight gain, growth delays, or other metabolic side effects, so regular monitoring is critical to assess for potential adverse effects. 211. When giving an injection to an infant, the nurse should use the vastus lateralis muscle, as it is the safest and most accessible site.
True or false?
Answer: true. Rationale: the vastus lateralis muscle is the preferred site for intramuscular injections in infants due to its size and accessibility, minimizing the risk of injury to nerves or blood vessels. 212. The nurse should administer solid foods to a 4-month-old infant to promote development.
True or false?
Answer: false. Rationale: solid foods should not be introduced until 6 months of age, as infants may not be developmentally ready for swallowing solids or may be at risk for choking. 213. It is important to assess for contraindications before administering vaccines, including egg allergies in children receiving the flu vaccine.
True or false?
Answer: true. Rationale: children with severe egg allergies should not receive the standard flu vaccine, as it may contain trace amounts of egg protein. An egg-free flu vaccine should be used instead. 214. The nurse should encourage parents to offer small, frequent feedings to a child with cystic fibrosis to improve nutrient absorption. True or false? Answer: true. Rationale: children with cystic fibrosis often struggle with nutrient absorption, so offering small, frequent feedings along with enzyme replacement therapy can help improve their nutritional intake. 215. The nurse should avoid using a high-flow nasal cannula, HFNC, for oxygen delivery in a child with a severe respiratory infection.
True or false?
Answer: false. Rationale: a high-flow nasal cannula, HFNC, can provide humidified oxygen and respiratory support, making it suitable for children with respiratory infections requiring supplemental oxygen. 216. A child with a known allergy to peanuts can safely receive a flu vaccine containing egg protein.
True or false?
Answer: false. Rationale: children with peanut allergies may not be able to receive vaccines that contain egg protein, and special considerations should be made to choose a peanut-free and egg-free alternative. 217. The nurse should not give oral rehydration solutions to a child with vomiting and diarrhea unless they are fully alert. True or false? Answer: true. Rationale: oral rehydration solutions should only be given to children who are fully alert and able to swallow. If the child is too drowsy or unconscious, intravenous fluids are indicated. 218. A 10-year-old child with chickenpox should be kept isolated until all the blisters have crusted over.
True or false?
Answer: true. Rationale: chickenpox is highly contagious, and isolation is necessary until the lesions have crusted over, which usually occurs about 5 to 7 days after the rash appears. 219. The nurse should routinely administer a DTaP vaccine at 4 years of age, according to the standard immunization schedule.
True or false?
Answer: true. Rationale: the DTaP vaccine is typically given at 4 years of age, as part of the routine pediatric immunization schedule to protect against diphtheria, tetanus, and pertussis. 220. Parents should be instructed to avoid administering Tylenol to a child with a fever if it exceeds 101 degrees Fahrenheit.
True or false?
Answer: false. Rationale: Tylenol, acetaminophen, can be safely given to children with a fever exceeding 101 degrees Fahrenheit to help reduce discomfort and prevent febrile seizures, based on the recommended dose for the child's age and weight. 221. A nurse should educate parents of a newborn about the importance of administering vitamin D supplements for bone health.
True or false?
Answer: true. Rationale: vitamin D is important for bone health and immune function in infants. Breastfed infants should receive vitamin D supplements to prevent rickets, as breast milk may not provide enough. 222. The nurse should encourage parents of a child with asthma to provide a daily dose of oral steroids even when the child feels well. True or false? Answer: false. Rationale: Oral steroids are typically used for short-term flare-ups and should not be used daily unless directed by the healthcare provider. Maintenance asthma therapy usually involves inhalers or other medications. 223. A nurse should avoid using acetaminophen for fever reduction in a child with a known history of liver disease. True or false? Answer: true. Rationale: acetaminophen can exacerbate liver damage in children with liver disease, so alternative fever-reducing medications, such as ibuprofen, may be more appropriate. 224. The nurse should immediately administer epinephrine to a child with an anaphylactic reaction after exposure to peanuts. True or false? Answer: true. Rationale: epinephrine is the first-line treatment for anaphylaxis, and it should be administered immediately in the case of a severe allergic reaction to prevent life-threatening complications. 225. The nurse should educate parents of a child with a new diagnosis of type 1 diabetes on how to perform regular blood glucose monitoring. True or false? Answer: true. Rationale: blood glucose monitoring is essential for managing type 1 diabetes, and parents should be taught how to check their child's blood glucose levels regularly to ensure proper glycemic control. 226. It is not necessary to assess for a history of allergies before giving a child any new medication. True or false? Answer: false. Rationale: a detailed allergy history is crucial before administering any new medication to prevent allergic reactions and ensure patient safety. 227. The nurse should use a tongue depressor when measuring the temperature of an infant.
True or false?
Answer: false. Rationale: a thermometer, not a tongue depressor, should be used to measure an infant's temperature. Rectal thermometers are commonly used for accurate readings in infants. 228. The nurse should administer medications to a pediatric patient according to the child's weight or body surface area for accuracy in dosing.
True or false?
Answer: true. Rationale: pediatric medication dosing is often based on weight or body surface area to ensure the child receives the correct amount of medication. 229. It is safe to administer the MMR vaccine to a child with a mild cold. True or false? Answer: true. Rationale: mild colds are not a contraindication for the MMR vaccine. The vaccine can be safely administered as long as the child is not severely ill. 230. A 4-year-old child with asthma should be prescribed a long-acting beta agonist as a first-line treatment. True or false? Answer: false. Rationale: long-acting beta agonists, LABAs, are typically used in combination with inhaled corticosteroids, not as first-line therapy. Inhaled corticosteroids are usually the first choice for managing asthma. 231. The nurse should encourage parents of a child with a new prescription for antibiotics to complete the full course, even if the child feels better.
True or false?
Answer: true. Rationale: completing the full course of antibiotics ensures that all bacteria are eradicated, preventing resistance and recurrence of the infection. 232. A pediatric patient with a fever of 103 degrees Fahrenheit should always be treated with antipyretic medication.
True or false?
Answer: false. Rationale: a fever of 103 degrees Fahrenheit may not require antipyretic treatment unless it is causing discomfort or the child is at risk for febrile seizures. Fever is often a natural response to infection. 233. The nurse should use a radial pulse to assess the heart rate of an infant under 1 year old. True or false? Answer: false. Rationale: the apical pulse should be used to assess heart rate in infants under 1 year old, as radial pulses may not be easily palpated in this age group. 234. The nurse should educate parents of a child with eczema to avoid bathing the child in hot water to reduce flare-ups. True or false? Answer: true. Rationale: hot water can irritate the skin and exacerbate eczema flare-ups. Lukewarm water is recommended for children with eczema. 235. The nurse should not administer live vaccines to immunocompromised children. True or false? Answer: true. Rationale: live vaccines are contraindicated in immunocompromised children because they may cause illness due to the weakened immune system. 236. For a child receiving a blood transfusion, the nurse should closely monitor for signs of transfusion reactions during the first 15 minutes. True or false? Answer: true. Rationale: the first 15 minutes of a blood transfusion are the highest risk period for transfusion reactions. Close monitoring during this time is essential. 237. A child with a history of asthma should use a short-acting beta agonist (SABA) inhaler before exercise to prevent bronchospasm. True or false? Answer: true. Rationale: a short-acting beta agonist (SABA) inhaler is commonly used before exercise to prevent exercise-induced bronchospasm in children with asthma. 238. It is appropriate to give a 2-year-old child honey to relieve a cough. True or false? Answer: false. Rationale: honey should not be given to children under 1 year old due to the risk of botulism. For children over 1 year, honey can be used in some cases for cough relief. 239. The nurse should administer a varicella vaccine to a child who has had chickenpox in the past. True or false? Answer: false. Rationale: children who have had chickenpox do not need the varicella vaccine, as they are already immune to the virus. 240. The nurse should encourage parents of a child with a fever to offer fluids frequently to prevent dehydration. True or false? Answer: true. Rationale: offering fluids frequently helps prevent dehydration, which is common with fever, and also aids in temperature regulation. 241. A pediatric patient with a severe peanut allergy should wear a medical alert bracelet. True or false? Answer: true. Rationale: a medical alert bracelet is essential for children with severe allergies, as it alerts healthcare providers and others to the child's condition in case of an emergency. 242. The nurse should initiate contact precautions when caring for a child with impetigo.
True or false?
Answer: true. Rationale: impetigo is a highly contagious bacterial skin infection, and contact precautions are necessary to prevent transmission. 243. A nurse can safely administer acetaminophen and ibuprofen together to treat a child's pain.
True or false?
Answer: false. Rationale: acetaminophen and ibuprofen should not be given together unless specifically directed by a healthcare provider. They may cause adverse effects if not dosed properly. 244. It is important for the nurse to assess a child's developmental milestones at every well-child visit. True or false? Answer: true. Rationale: regular assessment of developmental milestones helps identify any delays or concerns early, allowing for timely intervention if necessary. 245. The nurse should apply a cold compress to a child's sprained ankle to reduce swelling and pain. True or false? Answer: true. Rationale: cold compresses are effective in reducing swelling and pain associated with sprains by constricting blood vessels and reducing inflammation. 246. A child diagnosed with a urinary tract infection should receive antibiotics based on the results of a urine culture. True or false? Answer: true. Rationale: antibiotics should be prescribed based on the results of a urine culture to ensure the correct drug is used for the specific bacteria causing the infection. 247. The nurse should encourage a child with a cold to drink warm fluids to ease throat discomfort.
True or false?
Answer: true. Rationale: warm fluids can help soothe a sore throat and also keep the child hydrated, which is important during illness. 248. A nurse should administer oral iron supplements to a child with iron deficiency anemia with a meal to reduce gastrointestinal side effects. True or false? Answer: false. Rationale: iron supplements should generally be taken on an empty stomach for optimal absorption. However, they can be taken with food if gastrointestinal upset occurs. 249. A nurse should advise parents of a child with otitis media to avoid using over-the-counter ear drops without consulting a healthcare provider. True or false? Answer: true. Rationale: over-the-counter ear drops may not be appropriate for children with otitis media, and it is essential to consult with a healthcare provider before using them. 250. The nurse should administer a flu vaccine to a child with a fever. True or false? Answer: false. Rationale: the flu vaccine should generally be delayed if a child has a fever or is acutely ill. Vaccination can be given once the fever subsides.